I am feeling so much better. You probably saw me get my voice back in the last video. I was always under the impression that if you had laryngitis, that you had to rest your voice and just not use it and give it time to recover. So that's what I've been doing for several days. And then I made that video, and it turned out that what my voice actually needed was exercise. So as I started to talk more, my voice started to come back, and I am very grateful for that. But because I spent pretty much the whole of January really sick, and because I've had quite a few requests for this, I thought today what I would talk about is expat health insurance in Rwanda. What are your options? Where can you get it? What kind of prices are we looking at? So that's what I'm going to get into today. But before we begin, I am not a font of huge knowledge on this. I only know what I know, and I am not sponsored by or promoting any of the companies that I mention. I'm only talking from my own experience, and I very much encourage you to do your own research. And also, if you find some better alternatives, please leave them below, because this is a question that comes up constantly, and people are always looking for the best places to get health insurance. So with that said, let's dive in. So when I was drafting this video, my instinct was to say that pretty much every long-term expat in Rwanda goes with a company called UAP, which was renamed, I think, 2 years ago as Old Mutual. So I will say UAP and Old Mutual interchangeably through this video. They are called Old Mutual now, but I've known them as UAP for years. So anyway, I was just going to say, yeah, everybody goes with UAP. And then I thought, whoa, hold up there. Are you saying that because it's true? Or are you just saying that because that's what you think is true? So I put it to a local expat forum. And of the 22 people who responded, the vast majority of expats living in Rwanda and buying health insurance in Rwanda went with UAP. So it was true. I am one of those. So this is my insurance company. The reason that a lot of expats tend to go with the local insurers is because international expat insurance or long-term residency insurance tends to be eye-wateringly expensive, whereas local in-country insurers tend to be a lot cheaper. That's why I went with UAP, is firstly because their pricing I think is incredibly reasonable, and secondly because they're the only ones I'd heard of. It tends to be that, you know, in Rwanda it's a very small marketplace, so there don't tend to be that many options, and so when expats find one that works, it's just that's where everybody goes. So that's where I went. I would love to hear from any expats living in Rwanda who are not with UAP. I would love to know who you're with and what the package is like. Here you will never find a Go Compare site where you can quickly glance through the companies and compare their excess and, you know, their coverage and what they cover, what they don't. It's just not something that you will find here. And I'm going to go off on a quick tangent and just say I think it's the way that people exchange information in Rwanda. So you will usually see a job site and you'll have all these job postings, and not a single one will ever give a salary expectation on there. When you go into local forums and you see people posting things for sale, I'd say about 70 to 80% of the time, nobody will put a price on what they're advertising. And I don't know, this is just my theory and it might be completely wrong, but I feel like it's a transition between a traditional barter society into a sort of a more modern flat rate supermarket shelf society where you go and you see the price and that's what you pay. Because traditionally there was a lot more room to barter and to haggle over things. And so I think a lot of people advertising things will prefer to negotiate before giving any sort of starting price. And I might be wrong, but I feel like that's what it is. And that doesn't work with the Go Compare site where people are just, yeah, this is what we charge, this is what we can give you kind of thing. So I don't know. It's different mentalities, and it works really well for bartering societies where people will see an advert and go, oh, I really like that, I will contact the seller and we can negotiate whether to buy that or not. But it doesn't work so well with flat rate societies, which is most of the Western sort of foreigners, because they'll see that and they go, oh, I can't be bothered to enter into a discussion, I'll just leave it. So yeah, I think there's that. But because of that, there is no Go Compare sites, because companies aren't that willing to tell you straight up, what the price is and what's included. So what I thought I'd do is I'm going to put a PDF of my policy below so you can see exactly what I'm paying and exactly what I get for that. And then I thought, if you're with somebody else, if you'd like to send me a link to your PDF, and I'll put all the links below and we can become that Go Compare site. So if people are looking for other local insurers, they can find them. So if anybody wants to participate in that, drop me a line. Right, so UAP is the dominant health insurer in Rwanda. I'm just quickly going to go over the things that I like about them and the things I think they could improve on. The things that I like about them, first of all, the price, hands down. I am paying just under 240,000 francs a year for my annual coverage, and that's on quite a good package. That guarantees me a private room if I happen to really injure myself. So I should just explain that I only take out inpatient insurance. So that means that if I'm hospitalized, it's covered, but if I'm just popping down the pharmacy, then it's not. And that was a very conscious decision on my part, because what I was thinking about when I was looking at health insurance are, well, what am I most likely to need the insurance for? And the two big ones that came to my mind were, firstly, malaria. If there were complications and say it went cerebral, then that would require hospitalization. And the second one, the biggest one, was road traffic accidents. Internationally, I think in the last survey that was done, Rwanda is something like 15th in the world for road fatalities, which is fascinating because there aren't that many cars on the road. To put it into perspective, India was number 90. So you do see a lot of traffic accidents, and also I've started to drive myself at the moment, so I'm either on the back of somebody else's motorbike or I'm driving my own motorbike. Ever so occasionally I might rent a car. But yeah, traffic accidents and malaria were the two things that really, really stuck in my head. And I thought, yeah, they could cost a lot of money if you happen to be in intensive care and require specialist treatment. Whereas, from my experience in the past, and I'm going to hedge this because recently prices have been going up. My local clinic has pretty much trebled in price over the past few years. But generally speaking, outpatient care is not expensive. We pay a fraction of the price for drugs here that you would expect to pay in the UK. It really is not comparable. So if you're just doing outpatient care where you need to go and get your medicine from the pharmacy and you can treat yourself at home, you're never gonna spend more than your excess. It doesn't make financial sense for me. So I only buy inpatient care. So if I'm hospitalized, I'm taken care of to a relatively good standard. And that's what I like about UAP, is you can tailor your package to include inpatient, dental, long-term disability, cancer care. You can choose what to add and what not to. And that's why I only pay 240,000 a year, is because I'm not including lots of other things. If I was to include a full package including outpatient care, that would cost me a bit more. I can't tell you how much more, but if you'd like to go and ask, their offices are in Pension Plaza. So when you come to the big roundabout in town and you're going uphill towards UTC, so you've got UTC on your left, that huge, great big tower in front of you, that is Grand Pension Plaza. And if you just go up the right-hand side and in the steps, then you're right next to UAP, and you can just pop in and talk to them and they will give you a quote for what you need. So for me, the price is right. I can tailor the package to what I need. And they also gave me a loyalty discount for the first time last year. So it was a little bit cheaper because I'd been with them and I hadn't used my insurance in the previous year. So you would expect that from your insurance company to give you a little bit of a loyalty discount for sticking with them and for not having made a claim. But the last one that is really, really fundamental for me, and I think for everybody, you really must check this in your policy, whoever you go with, is that it says under motorcycling shall include pillion riding. This is fundamental to most people. If you are ever going to take a moto, you need to be covered for that. And that only came into my policy last year. So before last year, my policy, it included me driving a motorbike, but it didn't include me sitting pillion. And to most people, you go, well, yeah, I don't see why that's so important. But then you have to understand that in Rwanda, the main form of public transport is riding around on public motorbikes. So I am always either sitting on somebody else's motorbike or driving my own. And you have to be covered for that, because I see it from the insurance point of view. It isn't really the safest thing to be doing, but at the same point, it is the main form of public transport. So if you're going to get anywhere around the city on public motorbikes, you need to be covered for falling off those motorbikes. And until last year, that wasn't actually included. So always check your policy, especially if you're buying one from abroad where public motorbikes aren't a thing. Just make sure that you're covered for being a passenger, not just a driver. Okay, so that's why I like UAP. They cover me for motorbikes, which I take quite regularly, and the prices are right and I can tailor the package. Now, what do I not like about them so much? I'm going to just put it this way. Their attention to detail isn't great. And for me, I think if I'm putting my life in the hands of an insurance company, attention to detail is something that I really want to see. What do I mean by this? What is my evidence for my assertion here? Well, I've been with UAP for years. And not once have they ever sent me an annual reminder telling me that it's time to renew my health insurance. It always tends to be me sort of ratcheting around, sort of looking for my insurance documents and going, oh, that's expired. I should probably renew that. Except for this 1 year. This is the first year that they have ever contacted me to say, hi, your renewal is due. And how did they do that? Through Facebook. They contacted me through Facebook to tell me that none of my contact details were correct. They hadn't taken down my telephone number correctly. They hadn't got my email address correct, and neither of those two things have changed in years. So they've never had my correct contact details. And instead of typing in my name and contacting me through my business or a semi-official channel, their representative found me in an expat forum and decided to contact me through Facebook. So yes, a point for initiative for finding me and contacting me, but a pretty big L there for like not being able to keep your client's contact details correctly, especially when we're talking about medical insurance. They also got my age wrong. It wasn't a big deal. They'd only upped it by a year ahead of my birthday. But when I questioned them about this, they said, oh, well, they go by the year, not by the month. So they're putting up your age the minute that it turns January the 1st, whether or not you were born in February like me or October at the end of the year. Now, that might not seem like a big deal, but a lot of your insurance quotes and how much you're charged in your premium or your excess depends on how old you are. So if putting you up by 1 year before you reach that takes you over the threshold, then you're getting charged more because you're in an older age bracket before you're actually in an older age bracket, which I just thought was an interesting choice by by an insurance firm, you could see how that would work in their favour, not the clients. And the other thing that makes me think they're not quite entirely on it is because when I asked how much it would cost, what my renewal quote was, the quote had gone up by almost 27% from the year before. I was looking at one quote from the year before that said, like, I'm just looking at now, 230,824 to be precise. And it had gone up to 293,074 francs. And I was looking at that going, but I haven't made a claim. Last year, you made it cheaper because I hadn't made a claim. And now you want to charge me almost 27% more. Why? And that's when they went, oops, we made a mistake. It should only have gone up by 8,000 for some reason. We forgot to put your loyalty discount on. And I'm like, wow, yeah, did you forget? Or were you hoping that I wouldn't notice and that I would just go, oh yeah, sure, yeah, here's an extra 30,000. So those are three pretty big things: that they didn't get my contact details correct, they didn't get my age correct, and they didn't even get the quote correct until I pointed it out to them. And all of those things combined do not fill me with confidence about what would happen in an actual medical emergency. And thankfully, touch wood, I have never had one, and I've never actually had to call them in. I would love to hear from anybody who has called in UAP, whether or not it was a smooth process, whether or not it worked, because that also would help me to decide whether or not I want to stick with them or not. I am definitely open to shopping around. I've only been with them for this long because that's the only place that I really know about, and because a lot of other people use them. All right, so that's your local insurer. That's the one that I use. That's the one that the majority of long-term expats use. It's pretty simple just to walk in there, get a quote, sign yourself up. It's pretty affordable. How effective it is in an actual emergency, I don't know. So check the comments below and hopefully somebody else does. Just gonna put my hair up because I'm getting a little bit hot today. Right, so the other option that you have if you don't want to buy local health insurance would be to buy health insurance from your country of origin that covers you for long-term travel or long-term residency abroad. This does tend to be an eye-wateringly expensive prospect in most countries, but I did come across another option that I kind of found interesting, and I did actually go and check it out. It didn't turn out to be for me. I'll explain why, but it is an option. So the company's called Genki, and don't laugh, but I found them through a Facebook advert. Those do sometimes work. And I discovered them at the beginning of last year when I was about to go off travelling. So I went travelling for 3 months last year, but I didn't know that I would be going for that long when I left. And it was one of those situations where UAP actually do cover you for international travel, but you have to physically go there and get like a certificate for whichever countries you're going to. I didn't know where I was going to end up. I was footloose and fancy free, and I just wanted to wander around and have a bit of a walkabout, and I didn't know where I'd be, so I couldn't make use of that. So I decided to look for an international travel insurer. And this advert for Genki worked out really well for me. And I did end up going with them because it was so simple. I went to their website, I put in my age, and it just gave me a quote that renews every month. So at the time, I think it was €55 a month. Because of my age. I think it's a bit cheaper. I've got it written down here. So yeah, it's about $49.50 if you're in your 20s. By the time you get to my ripe old age, it went up to €55 a month. But what I really liked about it is they didn't ask any real questions. It's like they didn't care where you went, so long as it wasn't America or Canada. And you didn't have to worry about forgetting to renew your insurance or how long you'd be traveling, because it just went out every month and you were covered. covered, and it was pretty good insurance. I mean, it covered you for pretty much anything you want to do. So I took that out and I used that for the 3 months that I went traveling, and yeah, I was really happy with that. But again, like UAP, I've never had to call it in, so I don't know what they're actually like in an emergency. But anyway, when I got back to Rwanda, I noticed that they also do long-term residential cover, and I thought, oh, now that's interesting. So I booked myself in. There was a nice guy called Geordie. He was based in Thailand. I was in Rwanda. Our internet connection could not cope with that. So we sort of went from attempting a video call to a voice call. But you do need to go through a face-to-face interview with them if you want to inquire about residency coverage. They don't do that for just like travel insurance, but for the long-term residency they do. And it was really interesting because it's quite good coverage, but I think it came to something around 250 euros a month. Now that is what I'm paying for the whole year's insurance in Rwanda, but they wanted it per month. And the thing is, it's not like the hospitals would be any different the more that you paid. In Rwanda, you would still go to the same hospital, whether you're a private patient with an international company like Genki or a private company in Rwanda like UAP. They're not going to magically take you off to a gold-plated hospital with like rosewater fountains. It's, you know, you're going to the same place. So for me, it doesn't make much kind of sense to take out really expensive insurance, and at that price I couldn't afford it anyway. So I thought, oh, it was interesting to ask them about it, but UAP is still the better choice for me. Now, the only major advantage to consider about international insurance is in the event of medevac or death, they will repatriate you whether you're breathing or not. And repatriation of a body has come down significantly over the years. I think when I first moved out here, like 10 years ago, repatriating a body was something like £17,000 or something. Nowadays, there are companies that will do it for around 5,000. It's still a big expense, but if it is the last expense that you're ever going to spend, well, but yeah, if repatriation of bodies is something that concerns you and that you feel, you know, that you really need to have, then you are going to need an international insurer, because a local insurer is going to treat you as a resident of the country that you're in. They're not going to pay to send you back to Europe or America or Australia or anywhere else. So if repatriation is something that you really feel strongly about, you need to make sure that you've got an insurer that will cover that. Okay. Otherwise, that's kind of my take here. I would go with UAP or another local insurer that maybe I don't know about yet, because I think financially they make a lot of sense. They cover you for what you need to be covered for, especially if they allow you to tailor your package to inpatient or outpatient or both. Yeah, that's my advice. Now, it would be remiss of me not to just mention Mutuelle de Santé, which is the national health insurance plan in Rwanda. So all Rwandans are supposed to be signed up to Mutuelle de Santé, and that covers you in case of very basic needs. Now, from what I understand, and again, asking in an expat forum, thank you to Carolyn, who explained quite a bit of this information to me. As a foreigner, you can sign up for it for around 7,000 francs a year, I think. If you want to do that, you need to go to your local sector office. So your local Akarera, your local district office, and explain what you want to do, and they should be able to guide you through it. But just to explain, Mutuelle de Santé is not national healthcare like you would find in somewhere like the UK, or even private healthcare that you would find in other European countries or America. It does not provide the level of care that you are likely to need in the event of hospitalisation. From what I've heard, you cannot just go to a hospital with your health insurance, your Mutual de Santé, and say, treat me. You have to be referred there by a local health clinic, even in serious cases of illness. I did experience this once. I was leaving a house party and my friends and I noticed a woman in distress. She'd been the victim of a moto mugging. So there'd been a drive-by moto who'd tried to snatch her bag. She hadn't let go in time and she'd gone over on the cobbled street and she was bleeding, she was disoriented. We rushed her down to King Faisal, which is sort of the big, shiny medical hospital in Kigali, and they refused to accept Mutual de Santé. So even though she was covered by National Health cover, they wouldn't treat her. So we had a whip round and, you know, it had a happy ending. She was okay. We stayed with her. Her friend came. It was all okay. But that was my first ever experience of a medical situation where it's credit card first, treatment later. Being British, I know, you know, our health service traditionally has always been very different. It's free at the point of access, so nobody gets turned away. You're treated when you turn up at a hospital, but we pay for that through our taxes. Which is, it's a very different system. So for me, it was a bit of a shocker to see this quite American style, pay, where's your credit card details, give us your money, and then maybe we'll think about treating you. It was that kind of, and I realised that's how it is in most of the world. But Mutual de Santé is like that, you know. Yes, it's very, very cheap to sign up for, and yes, you can sign up to it as a foreigner. But would you rely on it in an absolute emergency? No. And it wouldn't provide you with the level of care that a local private insurer or an international private insurer would. I believe with Mutual de Santé, if you do want to sign up, there's a 10% excess. So you pay 10% of the total bill and they'll pay the rest. But again, you know, you do have to be referred from what I understand. If I've got it wrong, if you are a foreigner with Mutual de Santé, let me know below. If you think there are benefits to it as a foreigner, let me know below. But I would absolutely recommend that you stick to private insurance, either from an international firm or a local one. All right, so that's my advice on health insurance as an expat in Rwanda. If there's anything in here that you disagree with, do let me know below. If you know of a better option, let me know below, because that will help people out. Any other questions, let me know, and if I can, I'll try to answer them. Like I say, I'm not like the font of knowledge on this. But yeah, hopefully it's been useful, and stay safe, stay healthy.